Perfect.
They don't have, because that tree's got to serve two periods as it goes to Tillman and Neely.
Thank you very much.
Thank you.
All right.
Have a good lunch. Nice meeting everyone. Bye.
See you, Becky. All right, guys. I'm Lee. I am
Hi,
the guy.
Lee.
Hi, guys. Oh, this is a good class. I like it. I like it. Oh, this is a good turnout. You know, this actually, Seward is one of my favorite places to do these talks at. For some reason, it always gets a good turnout. People like and are engaged with, you know, what we're talking about and stuff. So this is always fun for me.
What?
Yeah.
I'm the fun one in the group.
Good. Hey, are you the one that said on your little sheet, huh?
Yeah, no,
All right,
no, that
that's
wasn't me.
somebody else. All right, somebody else had a good comment. They said, "What would you like to learn today?" Huh? Ha ha ha. So I don't know how I'll answer that. I'm working in my brain right now. But just a little bit about me. I'm Lee. I'm one of the specialists at Custom Hearing Solutions. We are the state's largest practice. We have an office in Omaha. We have an office in Lincoln. But here's what really makes us special: is we go to 40 retirement communities / nursing homes on a monthly basis. On top of that, we do 150 house calls a month. So we have over 40 people in Seward and the area that currently use our services, and they're our patients. So that's kind of fun. But me personally, I've been married for 10 years this year. I have 2 wonderful children. I have a 7-year-old daughter and a 5-year-old son who are amazing and fun. My daughter has had tons and tons of ear issues. So, you know, I picked this profession obviously when I was going to school, and the addition of my daughter having hearing trouble has really made me passionate about this. So you'll hear me say some things that hopefully that shines through, and you guys see that a little bit today. Anytime through this presentation, don't hesitate to stop and ask me questions. Happy to answer those for you. The format is going to be, I'm going to speak at you for about 20-25 minutes or so. As soon as I get done, I'm going to peek my head around the corner, let them know, and then salad bar, buffet, whatever you guys want. I don't think they serve alcohol, so this will be kind of a boring party, but that's all right. This crew thing, I think you can have fun without it. So, before I get started today, the point of this presentation is not to sit here and get you guys all hearing aids. I'm going to get that out of the way now. We're going to talk about that a little bit, but as a practice, we're more of a doctor's office than we are a hearing aid store. We do hearing aids more and better than anybody else in the state, but today's topic is to talk about the causes and the effects of hearing loss, because as a practice like ours, we aren't just focused on getting you to stop saying huh and what or get your wife or husband off your back. There's a lot more serious things that we talk about with hearing than just those things. So before I get moving into this, do you guys have any specific questions for me? All right, here we go. So I want to start off with the causes of hearing loss here today. And there's the obvious causes of hearing loss. Went to too many Beach Boys concerts, worked in the factories, worked on the farm equipment, loud noises, and getting older, right? These skin suits are designed to wear out. That's the way this process works. As we get older, things don't work quite the same as they used to. Your ears are no different than that. Now, when we talk about causes of hearing loss, this is the one I'm not going to spend much time on at all because you guys know that. But very quickly, I'm going to move to the left here, and I'm going to talk about cardiovascular disorder. So I want you guys to go ahead and do me a favor. Take your hand and scratch right here. Not hard, just a little bit. You can't hear that. But now do me a favor and scratch right behind your ear. You can hear that pretty good, can't you? So that
itch.
That's right, that's right. The anatomy that's right under that bone right there is called your cochlea. That's the inner part of your ear. And that inner part of your ear looks like a snail shell, and it has 27,000 hair cells in it called cilia. Now, think about this. 27,000 of anything in the size of something the size of my fingernail is pretty delicate and pretty small, right? That part of your anatomy is the most vascular part of your body. It's more vascular than your eyeball is. So it doesn't take much to damage this part of your anatomy. So when I talk about cardiovascular disorder, something as simple as high blood pressure, low blood pressure, can cause trouble with our hearing. Those little hair cells in your ear can be damaged by high or low blood pressure. Something as simple as dehydration or lack of oxygen can damage that part of our cochlea. So that's a really important thing to know. Now we move into the real heart things that can happen. You know, heart attacks, strokes, anything like that that is a major cardiovascular event absolutely has some effect on your ear. So if you've had a heart attack, you've had a stroke, or you just have high blood pressure or low blood pressure, chances are your ear has been damaged by that a little bit as well. So these are things that people most of the time don't know. So we just want to educate you so you know, hey, if this is something I'm experiencing, can I tie this back to something else for myself? Now, what's really important about this is these are not statistics that I came up with. This little booklet right here has all of the statistics in it that I'm going to talk about today. And statistics are only as good as their source. When you look in the back of this book, we pull our statistics from some of the world's most reputable medical facilities. So everything that I'm going to talk about today is you guys are hearing that, that's for sure. Everything that I'm going to talk about today is from one of the major medical institutes like Johns Hopkins University, the Mayo Clinic, the Lancet, WHO, the World Health Organization. So as I go through this today, you guys can always refer back to this if you want to dig deeper into one of these topics. So we talk about cardiovascular disorder. If you've had any type of cardiovascular issue, make sure to pay attention to your ear. That's something that can definitely be the case. Fun fact about this, there are actually several types of heart conditions or heart issues that now we can recognize through a hearing test before we can recognize through a blood test. So audiologists that are graduating are actually moving into cardiology offices. Really big cardiology offices, the cardiologist is employing an audiologist to say, hey, let's do a hearing exam to see if something's off there, because we can see things in that before we can see things in a blood test. So kind of a fun little fact right there. Any questions over cardiovascular?
I have.
Yeah, shoot.
Okay, I have Meniere disease.
Yes.
And I know I not have high blood pressure, but I lost hearing. I had about 30%.
Yep.
And I've had that about 4 years ago. And my spells that I get will last up to 5 to 7 hours.
Sure.
That's a full blown.
Yep. Yep.
And I have gone to, I don't know, everybody in the state of Nebraska, I think, but they still say that I do need a hearing aid, but the noise will never leave, you know, like the
Yes.
smell or heavy breathing.
Sure.
It will never leave if I do have a hearing aid, and they say I need 2,
Sure.
but I don't have insurance coverage, so I can lower it out. But I was kind of anxious to come to see if you knew anything about the Meniere's disease.
We do, and I'm going to dig into. So she says, "Hey, I've got Meniere's disease. Meniere's disease and vertigo can be very, very challenging for us, right? I mean, it rocks our world sometimes. If you've never experienced it, think about the biggest, baddest roller coaster you've ever been on, and just that's it, right? I mean, that's it. Laying in your bed, you're going to hit the floor pretty quick with these things. So I will come work with you specifically on that a little bit, because that's a can of worms, right? We can open up and talk about that quite a bit. So yeah. All right, next one I want to talk about is right down here, diabetes. This is kind of a buzzword in the United States right now. It's an epidemic, to be honest. You know, childhood diabetes, adult diabetes, all of these things are very, very serious things. Now, if you know much about diabetes, what you know is that it attacks your nerve endings. Everybody knows that, you know, if you're diabetic, your toes, your fingers, your eyes, those are some of the first areas to start noticing this. And then obviously your kidneys and areas like that. Well, we talked about that cochlea being very vascular and the nerve endings in there being very, very delicate. So folks who have diabetes, I'm just going to open this up right here for you. Diabetes, folks with diabetes are twice as common to be affected by hearing loss. That's a big deal, guys. And if you have hearing loss and you're diabetic, it's going to progress along at 2/3 times faster. So it's really going to expedite the loss process there. So if you're diabetic and you're noticing some changes in your hearing, that's just another one of those side effects that can come along with diabetes. Any questions over that? All right. The last one I want to talk about here on the causes of hearing loss is ototoxic medications. And this is probably the one where most of the time people's eyes get real wide. So oto meaning ear, toxic meaning harmful. So the FDA does a really, really good job pushing drugs out into the industry, and they do a good job screening for side effects as well. One side effect that they don't screen for is ototoxicity. So when drugs get put out, what we'll find sometimes is people will get on these drugs and their hearing will start to go away. They'll go get a hearing exam and we will start to notice there's some hearing loss. We actually report those findings back into the drug companies and they retroactively get labeled as ototoxic. So when you're reading through all those side effects when a drug first comes out, very, very rare the ototoxicity first is on there because we have to retroactively put that on there. Now, you guys don't ever have to worry about some of these drugs because the drugs that are on this list are pretty rare. We're talking about things like ibuprofen, Tylenol, aspirin. Any non-steroidal anti-inflammatory can be very, very damaging to that part of your ear. So high doses, consistent uses of those things is absolutely harmful to that part of your anatomy. So you want to pay attention to those things. And then we can move into some more serious ones like cancer treatments. If you've been treated for cancer with chemo or radiation, almost to a rule, we're going to see that you're going to have some damaging side effects to your hearing organ on there. So those are some really important things to pay attention to. And why we really focus on this one is, remember those little hair cells I was talking about back here? When you hear perfectly, my 5-year-old son, his hair cells are standing straight up and down like this right now. So the sound wave comes in, it hits the hair cell, and it sends a signal to our brain. Well, as he gets older, and what we're experiencing most of the time, is those hair cells start to bend over. Now that same sound wave that used to come in and stimulate the hair cell goes right over the top, and we go, what? And they said, I said pass the salt, right? And they say it louder, and it stimulates the hair cell, and now we get that signal. Well, when we have an ototoxic medication, it damages those hair cells at an accelerated rate. Here's the dangerous part about this, and here's why we focus so much on this, is if you're on a cancer treatment or something like that, and you're watching your hearing loss go away pretty quickly, when you get off the medication, it doesn't mean that your hearing's going to come back. If your hair cell's bent over at 30, 50, 70, 90%, it'll never be any better than where it's at. It cannot regenerate. So we're very, very pushy about this and saying, if you notice some changes in your hearing and you've got on a new medication or changed a dosage on a medication, get in and get a hearing exam. Because we've seen several people, here's another one that we see, very strong antibiotics. We've seen several people go on a 2-week stretch of strong antibiotics and go, my hearing changed a little bit, but I thought it would bounce back when I got off the antibiotic. They went deaf. I'm not kidding you guys. A dozen times a year, we'll see people come into our office and they'll go, it completely went away. If we could have caught it earlier, we could have worked with their physician and said, let's find an alternative that's not going to have that. And unless you know what we're talking about here and we educate you on this, that's pretty common, right? Because in our life, we have things that happen. We get a cold, we get stuffed up, our hearing goes bad, and then when the cold goes away, the hearing comes back. That's not the case when we're talking about an ototoxic medication. So antibiotics, non-steroidal anti-inflammatories, cancer treatments, all of those things are very, very common ototoxic medications. In fact, there's over 300 drugs on the list of ototoxic medications. So one thing we do for all of our patients is when you come in for a baseline hearing exam, we ask you to bring your medication list because we have a database we enter that information into, and it kicks back out the information to say, hey, is this one of the ototoxic medications? So we'll help you guys be your partner with that side of it. Does that make sense? Any questions over ototoxic medications? We learning something good so far? Yeah, interesting? All right, good deal, good deal. That's what I'm here for. I'm trying. All right, so when we go from here, the causes of hearing loss, I'm gonna bump right up to the effects of hearing loss. This is good stuff to know. In my opinion, this is even better stuff to know. So the reason I go from ototoxic medication to social isolation and depression is now. I'm going to make this connection for you. Human beings are built to be social, some more than others, but in general, this time of year, we really focus on, hey, it's Christmas time, let's get around our family, let's get around our friends, we're doing more church things, we're doing all these things. Well, a lot of you guys, when that fan kicked on, or just the idea of coming here, makes you go, oh, this was a mistake. Because hearing loss doesn't start by going deaf. Hearing loss typically starts by, I go to the restaurant with my family, and I nudge my wife, I say, what? Huh? What they say? What they say? And after everybody gets sick of that, I usually sit at the table and do this. Right? Right? So this can be very uncomfortable for us because we go, oh, I'm just going to go to another thing where everybody's upset or I just don't get to pick the conversation out like I want to. So what happens is when we start having trouble in those situations and our kids and our wives and our friends make jokes at us because we can't hear quite right, because it can be funny sometimes, but when we start having those situations, we start saying, you know, I don't think I want to go out tonight. Or I'm not going to go to church this week. Or I don't want to go to fellowship dinner this week. I don't want to do those things. So we start socially withdrawing from the things that we like to do. And that's not the way we were designed. And our sphere of influence gets smaller and smaller and smaller. And what happens when that happens, we start feeling a little bit sad, right? So when we start feeling a little bit sad, we may decide, all right, I need to go to the doctor. I need to go and figure out what's going on. So I go to the doctor, and they say, yeah, I think you're a little bit depressed right now. Let's take a look at this. What do you think the doctor's going to do if you're a little bit depressed?
Put you on medication that's awful.
Ototoxic medication. The number one culprit on ototoxic medications, antidepressants. So I am not saying an antidepressant is going to make you go deaf or fixing your hearing loss is going to get you off all antidepressants. But what I am saying is there is a direct connection between I'm feeling a little bit sad, I'm feeling a little bit depressed because I can't hear quite right, and I'm not going to events. They put me on a medication that makes me hear worse, that makes me more sad, and it's this vicious cycle, guys. We need to really pay attention to this because many times we do find that people are more happy and more engaged when they take care of their hearing. So kind of an important deal there. Antidepressants just got added to this list, and we knocked these two off right here. And I don't like to poo-poo this, right? This is kind of a big deal. Again, being engaged, being social is how we're supposed to be. Any questions over this at all? All right, good, good, good. The next one I want to move to is right here. So, does anybody, and if you guys don't get this right, I'm packing it in now. Does anybody know what the number one cause of death is for people over the age of 70?
Falling down.
Oh, you guys are paying attention. All right. Risk of falls. Risk of falls. So, if we have untreated hearing loss, we are 33% more likely to have a balance-related fall. That's a big deal. And again, when that's the number one cause of death for people over 70, I really start paying attention to that stuff. I was raised by my grandparents, so I'm very, very aware of this. And even if a fall doesn't kill you, which oftentimes it obviously can, we don't heal like we used to. You know, my 5-year-old, we've got a Wheaton Terrier that we got as a puppy, and when my 5-year-old was 4, so yeah, he's about a year old now. And this dog and him play so hard that the other day they were running through the living room and this dog attacked. You ever seen those police videos where the dog runs and knocks the guy over and tears him around a little bit? That is what happened. And I thought, my son is dead. My dog just killed my son. And he hops back up and he keeps playing. And I know if that was me, I would have had to lay on that floor for quite a while and I'd be black and blue from head to toe the next day, right? So that's what happens. As we get older, we don't handle those same types of events the same. The fall gets more serious. Maybe when I'm 50, those falls result in a broken leg or a torn muscle or something like that. When we get to 60 and 70, it resolves in a broken shoulder, a broken hip, or something along those lines. And in that case, if it doesn't kill me, what happens is I go to the doctor, I get a hip replacement. And if I get a hip replacement, I stay in the hospital for a while, then I go to a rehab facility, then I go to assisted living facility, and hopefully I get all the way back home without getting pneumonia or an infection or something else. So there's a lot of stuff we can really pay attention to here in reducing that risk of falls, because we know that if you have untreated hearing loss, you're 33% more likely to have one of these falls. That hearing organ isn't working like it's supposed to. Any questions over that one? All right, the last one I want to talk about is right here. And again, being raised by my grandparents really opens my eyes to this. And as a practice, we're really in tune with our patients and our demographic. In college, in every phase of life, we have different stuff that we're focusing on and different stuff that we're worried about. Right now, my kids are really worried about getting coal in their stocking, right? So that's the big issue in their life. When I get to college, my issue and my concern was not getting an A, but also finding my wife, right? Like those are the things like, God, I don't want to be alone forever. Let's figure this thing out, right? So my worries start to change. Where I'm at right now, my worry is, how am I going to pay for my kids' college? So those are things that are in the front of my mind. My next phase will be, how do I pay for retirement? Well, what we know now is what this typical demographic is worried about, maintaining independence, and big part of that is cognitive decline. Really scary words right now are dementia, Alzheimer's, and memory loss. Those are really scary words. So there's been a lot of research and money put into these topics. What we know now is folks who have untreated hearing loss are 25% more likely to be affected by dementia, Alzheimer's, and memory loss. So flip that, what we know is, if you treat hearing loss, you're 25% less likely to be affected by dementia, Alzheimer's, and memory loss. That's a big deal, guys. I mean, 25% is not a small number. And what's fascinating about this to me is we will give people these statistics, we will give people these books, and they'll go, that's not true, I don't think so. But they'll go home and they'll buy raspberries at the store every day and eat that handful of raspberries for the antioxidants and the healing powers that it might contain. We've got concrete evidence that we can reduce your chances by 25%, but they're content just eating their raspberries and hoping it does something for them, right? I'm not going to fault them. Keep eating the raspberries, but if you're going to take that approach, you also need to take the approach of, hey, if there's a proven way for me to reduce this, then let's take a look at that. And how this works is, there's 4 parts to your ear. There's the outer, the middle, and the inner ear. And then the 4th part to your ear is in the brain called the acoustic imaging center, or the auditory cortex. We hear with our brain, the ear is how it gets there. So the first half of our testing is to find out how well is this part of our ear working. The second part of our testing is to establish how well is this part of our ear working. We have to look at those results separately, because what we know is we can find a big gap between this part and this part. And wives, it's not every man, okay? That's not the case. That is not the case. But we can find a big gap between that. So it's really important that we pay attention to those things, and that's part of having a baseline test, is if we start noticing some differences, we want to try to get ahead of the curve on that. One of the things I read in here is I want to be ahead of the game. Getting ahead of the game is educating yourself. And that's what this process is. That's what being here is, guys, is you're getting ahead of the game by just gathering the information. This is a big part of it. Do you guys have any questions over this at all? Yes?
I'm sorry, I didn't catch the 4th part of the ear, the acoustic.
Acoustic imaging center.
Thank you.
She's a teacher, she's gotta take notes.
That's all right, I'm with you on that. Auditory cortex. All right, so that's the causes and the effects of hearing loss that we like to talk about. And now I'd like to go into just a little bit of, you know what can we do about this? What should I do about this? And I told you, our point of this isn't to get you guys hearing aids. As a practice, our goal is not that. And I tell people a story about my grandpa. Is when I was younger, it was only 5 years ago, when I was younger, my grandpa was told he needed a pacemaker. And we all went to the doctor, and the doctor looked at my grandpa and said, you need a pacemaker. And my grandpa said, no way, not doing it, not happening. Well, the whole family went into an uproar and said, you gotta get the pacemaker, you gotta get the pacemaker. He didn't get it. Well, a couple of years ago, he passed away. Any thoughts on what killed him? His heart killed him, right? So, and here's why I look back at that situation. I go, number one, my grandpa was a heck of a stubborn guy. Like, that's just the way he was on everything. But number two, I look back at the situation, I look back at his cardiologist, and I say, that guy did a really good job with my grandpa. The reason I say that is it wasn't his job to say, hey, he needs a pacemaker, hold him down, guys, and let me sew this thing in. That's not his job. His job was to identify a problem, identify a solution, let him know what the consequences were if he didn't take care of it. My grandpa knew it was going to happen. If it wasn't a plane wreck or something crazy, it was probably going to be his heart that took him out at the end of this thing. That's all right. He knew the decision that he was making. The same thing happens with this. It isn't our job to say, you need a hearing aid, quick, get the super glue out, and let's glue this thing to your head. That's not our job. Our job is to identify a problem, identify what the consequences are if you don't take care of it, and then from there we can start talking about, hey, if you don't want to do it, that's completely fine, but at least you're educated on what the consequences are of not taking care of it. Because when I was in my freshman year of college, I'll tell you this, I'm a prime example of this. I went to college wrestling, so I had a little bit of a wrestling scholarship. I told you I was concerned about finding my wife, which I'm very blessed that I did. And one of the last things on my list was weather class, right? I didn't really care about weather class. So here was my approach to weather class. At this time, online grades were a thing. So we would get homework. I wouldn't do my homework. We'd know that there was a test coming. I didn't always study for my test because that was the time I wanted to go out with my girlfriend, which is now my wife. So I would go take the test, and I would never look at the grade online. I'd never log in to look at it. They didn't mail report cards. They didn't tell us in class. You had to log in and look at it. So I assumed, this is pretty good, guys. This is good thinking. So I assumed, all right, if I don't log in and look at this thing, I must have got an A. Was that good logic? No, the truth came out at the end of the semester. So putting my head in the sand isn't a good solution. Not knowing this information isn't a good solution. A lot of people go through life content with that. That's not what we want to do. Again, we're not here to force you to do something, but we're here to educate you on the things that you need to know to make an educated decision. You guys have all been independent for a long, long time. We want to help you maintain that independence. And being independent doesn't mean being forced to do something. So that's a big part of this. Any questions for me so far? All right, so one thing that we really focus on, I'm going to go back to this dementia and Alzheimer's and all of these things on here. One thing people don't realize is when you get a hearing exam from a practice like ours, it isn't just a hearing test where you say yes or no and I could hear or I couldn't hear. We go through a series of 5 different tests to find out if you have hearing loss, if you do, how much do you have, what kind is there anything more serious underlying, and is it treatable? We're going to find all those things out for you. And at that point, we're going to flip the computer screen around and we're going to walk you through those. But what else we find out with those hearing test results is what's causing my hearing loss and what are the effects of my hearing loss. Because what we know is if cardiovascular disorders is causing your hearing loss, an audiogram is the chart that we look at hearing test results in. We have low tones and we have high tones. If your low tones are bad and your high tones are good, that's typically a cardiovascular problem. If it's an ototoxic medication problem, it's what we call a cookie bite, where the shape of the audiogram tells us what's causing the hearing loss. So we can help you guys identify that. It's not to just find out if you have a problem. We can be your partner in finding out what is causing my problem. It could just be getting older. It could be you are pretty bad and your wife yells at you a lot really loud. That could be the case. But we can help identify those things. Now on the effects of it, this is another test. We can see, am I at risk for this? Am I at risk for this? We don't just come up with these statistics and information out of the clear blue sky. We know that if I know what's causing my hearing loss and I know what my audiogram looks like, I can know if I'm in this camp, am I in this camp, am I in this camp? Because if I have untreated hearing loss, the part of our brain, that acoustic imaging center that gets damaged, we do a word test and we find out how well can they understand words. If we miss a bunch of words in there, we find out that the acoustic imaging center is beginning to decay. Doesn't matter how loud we turn the volume up, the brain can't process the signal properly. And this is where that statistic of 25% comes in. When you have untreated hearing loss, that part of the brain, when that decays, it's called auditory deprivation, and that progresses at 7 to 12% a year. When you treat untreated hearing loss, it progresses at 1 to 3% a year. There's no stopping it. There's no turning it backwards. The best you can do is slow down the rate of progression. I'm going to start this, or end this, just like I started this. These skin suits are designed to wear out. The goal isn't to live to be 150. The goal is to live as long as I can with a really good quality of life. Because they could keep us alive indefinitely on machines in a hospital bed. Who wants that? None of us want that. What we want is a really good quality of life. So when we can reduce that rate of degradation from 7 to 12 to 1 to 3%, that prolongs our quality of life for a long time. One last statistic on this. This was just published in The Lancet. Does anybody know what The Lancet is in here? The Lancet.
Medicated book.
Actually, The Lancet is the world's most reputable medical journal. So every medical profession from every country, every walk of life contributes their research into this. Now, the Lancet published a study, was where we get the 7 to 12% and the 25%. That was a year ago. What we just found out a couple months ago is if you've been diagnosed with cognitive decline, dementia, or Alzheimer's, and you have untreated hearing loss, it progresses 60 to 70% faster. That's big, guys. That's really big. Again, our goal isn't to live longer, it's to live longer with a quality of life. And that's what this is designed to do. We can help those things out. Sometimes treating hearing loss can be as simple as pulling a little bit of earwax out. Sometimes it could be a hearing aid. Sometimes it might say, hey, we've got a tumor in there. Hey, we've got those little bones in your ear called the ossicles. They can be broken. If I've got arthritis in my knees, does anybody in here have a little arthritis? A little bit, right? So there's 3 little bones in your ears called the ossicles, and they're on joints just like my fingers. If I've got some arthritis in my knee, it stands to reason that we should see if there's some arthritis in those bones that aren't allowing them to move, because a hearing aid won't fix that. So we need to find out what is the problem. Because like I said, it could be a tumor, it could be wax, it could be the hair cells, it could be a whole bunch of things. Our job is to partner with you to help you get those answers. I'm going to go tell him to cook some pizza. I'll be right back. Okay, she said give me a little warning. So I'm coming in for a landing here. Yeah. I do. Yeah, I'll just take my
Well, it's not an hour yet.
We're coming in for a landing. Not quite yet. You said give me a little warning, so I'm doing it. Yep, that'll work. All right. All right. So, like I said, we're going to partner with you to do those things and help you understand what's causing my hearing problem, which one of these categories am I at risk for. That's a really important part of this. So, that's this piece of it. Any questions so far? All right. My goal today is to sign every single one of you guys up for a free hearing test. Hey, who likes the word free? I sure do, right? So when I say that, we're not a twist your arm type person. If you go check us out online, we've got an A+ rating with the Better Business Bureau. We've got loads of 5-star reviews on Google. We've got reviews coming out of our ears. People send us cards. We get more peanut brittle than we know what to do with at Christmas time, right? So this stuff just comes in from all directions. Hey, the peanut brittle is an indicator of how good are we doing as a practice. So that's what we use, right? But these are the things that we focus on. And our goal today is to help educate you guys. So hearing tests usually aren't free. Usually there's a cost to them when we talk about this. But when we're out here in this setting, you guys took the step to come here, and it's my job to say, look, I educated you. Maybe I even scared you a little bit, right? That's kind of important to know. We need to know these things. Let's help answer those questions. So we open up a bunch of testing spots at no cost for you guys. And then, look, at that point, we'll find what the solution is. Just like I said, we're not going to say, get a hearing aid, get a hearing aid. We're not going to go used car salesman on you, right? We're going to help you make an educated decision. If that's something you want to do, we can help you with that. If it's something you don't want to do, that's okay. At least you're walking out the door knowing what the consequences are. Or maybe you have normal hearing and there are no consequences yet. We see that all the time as well. We do over 150 hearing tests a month. So we do a lot of hearing exams. We see a lot of people. So I've got a bunch of testing spots here. I'm going to walk around and work with everybody on this. If you want a hearing test, I'm here to help you. Does anybody in here want a hearing test after this today? I see some hands going up. Yep, absolutely. All right. Now, the last thing I'll tell you about our hearing tests is we are the state's largest practice. And we are the state's largest practice because I mentioned we make 150 house calls a month. That's something we'll never stop. As technology is advanced, we've bought equipment that's designed to get the same result in our office as we can sitting right here in Godfather's or sitting at your kitchen table. So we realize that mobility, weather can kind of stink sometimes. Those things can prohibit us from getting out and getting things serviced. So when I walk around here, when we do hearing tests in people's homes, you're not getting a watered down solution. Everything we talked about here is the exact same test that we do in the office. If it was watered down, we wouldn't offer it. So we're going to offer the exact same thing. If you don't want us in your house, I completely get that too. You can come to our Lincoln office around 48th and Pioneers. But whatever you guys want, we want to make you guys comfortable. Any questions for me? All right, guys.
Hearing and falling, or whatever you call it, vertigo.
Yep.
Or you yawn and all of a sudden it gets awfully loud in church. You're going, oh, I shouldn't be singing like this.
Ah, that's good. You want to know what that is? So,
yeah,
right
that's
now,
what I want to know.
You've got one way to hear, and it's through your ears. Well, the middle part of your ear, which is between the skull and your ear canal, there's an eardrum and a cavity inside there. Well, in that cavity, there's a floor drain called your eustachian tube. What happens is, when kids are young, a lot of times they don't have this eustachian tube developed. So they'll get ear infections and there's nowhere for that fluid to go. So what'll happen is they'll cry and they'll be really uncomfortable, and eventually you'll see this gushing of fluid come out of their ear. What's happened is they've got a ruptured eardrum at that point, and all that fluid could finally escape, and that's painful. Well, what tubes are, is what they do is when that eustachian tube isn't developed, they take this little tiny window, put it inside that eardrum, and that allows the fluid somewhere to go. So when you see fluid coming out of a child's ear, it's because they've got tubes in their ear and an ear infection right now. And most of the time, the pain almost always goes away. That doesn't answer your question. So, answering your question has everything to do with that. When you
lay down, I turn over in bed,
yep.
and the ceiling fan's turning, but it's not on.
Yeah, yeah. Well, and go back to your one about singing in church.
Yeah.
When you yawn real big like this,
And then
what happens
boom.
is, that's right, you've got all that sound now coming in from your ears. Oh, I've got a third ear. Because now that sound's going in my mouth up through my eustachian tube, so it feels like we've got Spider-Man hearing, right? Like this extra sense that we don't usually have. It's because we've got another orifice that the sound is coming in and getting into the middle part of our ear and stimulating that cochlea. Does that make sense?
Oh, yeah.
Good deal, good deal. You got it, you're fine, you're fine. So that was a really good question. In fact, I'm gonna move through these other questions I have real quick here. Hearing loss, information on hearing aids. So here's one that says information on hearing aids. This is not something we get in too much to this topic here because it's not the point of this. We could talk a whole nother presentation on this, but hearing aids are kind of an important deal when we're talking about correcting hearing loss. You want to be working with one of the 5 main manufacturers: Starkey, Unitron, Phonak, Siemens, or Resound. These are true medical devices. They are not Costco, Sam's Club, Beltone, Miracle Ear. Those are amplifiers, right? Those are very different than what these 5 main manufacturers are. So you want to be working with one of these guys because these are medical devices. They're classified as an internal medical device, the same as a pacemaker or a hip replacement. So these are the type of devices we work with as a practice. So you want to be with one of those guys. Now, people say, I don't want one of those big ugly ones, or I don't want one of those tiny ones that goes down in my ear. The truth is, you guys don't get to decide that. All right, now I gotta say, I don't get to decide it either. What the truth is what type of hearing loss you have, what your audiogram looks like, is what decides what type of hearing aid you should have. In fact, if you go to a practice and you tell them this is the type of hearing aid I want, and they say this is what you'll get then, get out. That's not right, right? It's because you need the hearing aid that fits your hearing loss, not just one that you want, right? Because the goal of this isn't to get a hearing aid, it's to hear better. And when you're fit with the right device, the style as well as the manufacturer, you're going to do much, much better. And then we look at all 5 manufacturers and go, well, what's the difference between them? All 5 manufacturers do something very specific. Here's some examples. Phonak has the best pediatric hearing aid out there. So we have a large practice and we fit pediatric patients. Every single one of our pediatric patients gets fit with a Phonak hearing aid. Now, I'm not the brightest guy, but that ship has sailed for this room, if I'm not wrong, right? None of us are pediatric in here anymore. So there's not a single person in here that gets a pediatric hearing aid. Now on the other side, Starkey has a really great technology hearing aid. If you want a hearing aid that hooks up to your smartwatch and your phone and your car and all those things, Starkey's where to be because it's going to do that. If you want a completely automatic hearing aid, Unitron is where to be. If you want a rechargeable hearing aid, Siemens is where to be. Each one of them does something very specific. So it's important to be with a practice that works with all 5 of them. Most practices don't get to that level because the economics of whatever it is says, hey, if I buy 10 hearing aids from a manufacturer, I'm going to get a certain price. If I buy 100, I probably get a little better price. Same when you go to the grocery store. I buy 1 can of peas and it's $1. I buy 3 cans of peas and it's 50 cents a piece, right? So the quantity drives the price down. So as a practice, we've not crawled in bed with one manufacturer. We took our volume and said, hey, we're going to work with all of you, but we're not going to work with all of you on any kind of contractual basis. We're going to pick what's right for the patient. So I see some people in this room that a hearing aid that hooks up to your computer or your smartphone or your watch isn't right for. I see some people in this room that that's a perfect category for. So we're going to work with you on making sure we get the right hearing aid for your hearing loss. Does that make sense about hearing aids? I want to definitely hit that information on hearing aids. Anybody have any additional questions on that? All right, all right. knowledge. You guys came to the wrong place for that, sorry. To get ahead of the game, we addressed that. Sensitive ears. This is kind of a cool topic, actually. So, somebody says, sensitive ears, I don't like loud noises. Everybody thinks that as I lose my hearing, I like to hear things louder and louder. That's not true. What happens is, as my hearing goes away, my tolerance for loud noises actually decreases. This is called hyperacusis. So, again, what happens is my hearing goes away, my tolerance decreases. We do this test in the audiology office because the smaller this range between my hands gets, which is our usable hearing called our dynamic range, the less treatable hearing loss we have. So we look at this test and we say, do you still have a treatable hearing loss or not? Because once this range is here, it never goes back to here or here. It's as big as it's ever going to be right here. So we have to find out, do I still have a treatable hearing loss or not? With hearing aids, true medical devices, the point isn't just to make things louder, it's to put a ceiling on it and say, it needs to be louder than this, but never go louder than this right here. So a true hearing aid, you should have no sensitive issue to loud noises. The only caveat to that is if my dynamic range is this, and there's no space between there, it's probably not a good fit. We see a lot of people every month where we say, we could get you a hearing aid, but you're not going to like it. It's very uncomfortable. You can wait yourself out of correcting hearing loss. So again, another reason that we should really focus on this and know where you're at right now, because if you're hearing you don't have a lot of margin, that's okay if you don't want to fix it, but you should at least know I don't have a lot of margin left at this point. Make sense on hyperacusis and sensitivity to loud noises?
Like pig squeals?
Yes, that's right, that's right.
Can't stand them anymore. I can tolerate them.
Know how much hearing aids cost. Hearing aids can cost a whole bunch of different prices. They can be as cheap as $900. They can be as expensive as $7,000. It depends on your hearing loss. The longer you wait, the more expensive it gets, guys. That's the facts of it. That doesn't matter where you go. You could go buy a truck. If I want a truck that doesn't need to do very much but haul a couple hay bales around, I can probably get away with like a little S10 or something small. But if I have a big horse trailer that I want to pull, I'm going to need a much bigger truck. Does a much bigger truck cost more?
Yeah.
It does, right, that's exactly right. So the worse it gets, the more it costs. There's a lot of benefits to taking care of this earlier. We work with you on all those sides. Being the size of practice that we are, we work with all major insurance companies. Medicare doesn't cover hearing aids, but the list of supplements is growing dramatically on plans that we can order off of to reduce the cost of hearing aids. So there's a lot of help out there. You need to be with a practice big enough to be able to utilize those. The guy working out of his bedroom isn't going to have access into those. We've got a staff built for our billing department. So we know that. And when you come in, we take a copy of your insurance card and see if there's any coverage for you. All right. Hope to learn something. It was in some direction. Is miracle the answer? I think we discussed that. I don't believe it is. I'm biased. Let's see, and then get a sense of direction. I think. Yep. I think I addressed most of the questions in here, guys. Just looking through these, and that's our goal. That's what we want to do. Any additional ones that you want me to hit real quick?
Vertigo.
Vertigo. I'm going to hit you with that one.
I had an inner ear infection once.
Sure.
Way back in 1980.
Yep.
And every once in a while, it comes back roaring itself, and I'm just like,
Yep,
you know?
it rocks you around. That's right. That's
Yeah.
right. Yeah, and I'll work with you. It's kind of on the lines of Meniere's disease, so that one's in there. I'll work with you specifically on that. Does anybody wonder, I'm just thinking of a question here that affects a lot of folks that didn't get asked. Ringing in your ears, does anybody?
oh, constantly.
Tinnitus,
yeah.
that's exactly right. So here's an interesting thing about tinnitus. Everybody has it. I use my kids as references a lot. My 5-year-old son has tinnitus in his ears, but here's the difference. I'm going to give you an example. If I was to take a match and light it right here, that match would be a certain brightness. It wouldn't seem very bright in here because we got all this stuff going on, but if I shut the lights off and pulled the shades, that match would seem a lot brighter, wouldn't it? Then I pull the lights back on and open the shades again. The match is still the same brightness, but it doesn't seem the same, does it? So, tinnitus is the same way. That sound that you're experiencing is in every single one of us. But what happens is, as our hearing starts to go away, the distractions that our ear would typically pick up out around us aren't there anymore, so we start focusing on those internal sounds. And you guys do this test every day. when you lay down to go to bed at night, oftentimes you find that the tinnitus might be a little bit worse. There's even less distractions going on around you. So that's a really important piece of this. Hearing aids in themselves, most of the time, will correct tinnitus. But the 5 main manufacturers got together and a few years ago bought the tinnitus masking patent from a company. And now, for people with severe tinnitus, what happens is we treat the hearing loss and the tinnitus almost always goes away. But if that doesn't do it, there's features inside all these 5 main manufacturers' hearing aids that we can mask the tinnitus at a greater level. So we can make tinnitus go away for you guys. It's never really gone, because even my 5-year-old still has it, right? But as we have more hearing loss, that tinnitus is going to be more and more bothersome. Kind of fun fact, if you have low tones that are going away, you're not going to hear a squealing sound. You're going to hear your blood flow. You're going to hear thumping sounds and things like that. Let me get this fellow a card right here. I know he's got to get back to work. Okay, here you are, man.
Thank you, buddy.
No
terrible.
Amen, amen. So if you have a low tone hearing loss, you're not going to notice high pitched sounds. You're going to hear boom, 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 or shh, 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 because you have blood flowing problems and you're hearing your blood flow in there. Now, if you have high frequency hearing loss, you're going to hear the crickets, you're going to hear the cicadas, you're going to hear those things because my body's losing the ability to hear the high frequency sounds, so it's going to focus on the internal high frequency sounds. So you can almost diagnose yourself with what amount of hearing loss and and what frequency it's in by what am I hearing at night. That's it on tinnitus. So
That machine.
yeah. All right, guys, I see they loaded up a whole bunch of new pizzas for us out here. I'm going to let you guys go get some food. I'm going to walk around from table to table. If you guys want to book a hearing test, I'll go around. I'll write your appointment on here. I'll get you one of these little booklets, and we'll go from there, okay? Thank you guys very much for listening to me talk at you. I went for 40 minutes, not 20, so I appreciate you being patient with me. So.
You can keep on going if you want.
Pizza's up. Let's get it.
Dentist again today. Get dentures and stuff like that affect your hearing? That was what I was going to ask you.
What was that?
If dentures or partials can affect your hearing?
I don't know much about that piece of it. I can't say.
I was just wondering, you got a bad bite or something.
Sure. What we do notice is certain types of hearing aids, there's a lot of little bones in your ear canal. So certain types of hearing aids, if you build a real nice tight fit in there, when you're eating, you hear that the bones shifting in your ear. So
Oh, I do. I hear all kinds of clicking and clacking.
Yep, that's
Yeah,
right.
that's
That's right.
me.
That's right.
See, I have all kinds of leg problems because I fought with a cow and the cow won.
Oh shoot,
So I'm just-
shoot.
Wait till you see
That's
me
not
go
a
down.
fight you want to pick.
Have to go down stupidly.
Oh, did I miss your question? Or are we good? All right. Okay. Is that good, guys? Do I get a passing grade?
Oh, might be a B.
At least you're honest. I like that.
My hearing, I've been around construction all my life.
Yep.
In the military, I was around loud stuff. But one thing about the toxic part, I got a doctor who I take a couple, 650 milligram for arthritis and 81 milligram because they say, well, it ain't gonna hurt you. And now I'm wondering if that does or not.
Well, and that's one thing we'll find with the test, right? Because we know ototoxic medication has a certain shape of audiogram inside there. So when you come in and have an exam, we'll do the test and we'll find out, is that hurting you? Now, that's hurting your ears. We're being very, very narrow on our scope, but we can at least identify, is it damaging my ear? There could be other things that it's damaging, but we'll be able to take that one off or on the table for you.
Okay. Yeah, that part I
Isn't that amazing?
I gotta do something with it. I work out in the shop. I like to tinker with stuff.
Sure.
And invariably you get to beating on a piece of steel. And that always has scared me with hearing aids because I got friends that have them and they said, oh, some smart ass will have to hit the table with a hammer just to torment. And so I've always stayed away from them for that reason.
Did that make sense where I was talking about that hyperacusis? Because
Yeah.
That's a
and-
common concern. When you have hearing aids and you're still working and active and stuff, when we program that hearing aid, we say you need to be louder than this, but never go louder than this. So that way when that smart person comes up to you and does this thing right in your ears,
Yeah.
it doesn't hurt you, right? Because that's kind of not fun.
Okay,
Yeah.
I'll come around when you guys get your food and see if you want to book a hearing test, all right?
well. Yeah, I think I do.